It is maybe the first we need to. So I need to talk about the introduction for the STEM trial. The STEM trial is the adjuvant phase 2 trial in the open label, randomized, the comparing the capecitabine versus the gemcis for resected BTC patients. So the current standard is a capecitabine, but many investigators have thought that the gemcis may be better, show better efficacy than the capecitabine. But our study showed that the adjuvant gemcis did not show any the positive outcomes compared to the capecitabine, which indicate the capecitabine should remain as a standard of care for resected BTC. So this ctDNA analysis was conducted as whether the ctDNA may give any information about the recurrence before the presence of the tumor recurrence in the CT scan. So yeah, that is the introduction. Yeah. Results are quite interesting. So the minimal residual disease was detected using the ctDNA after surgery. So if the patients have the minimal residual disease and using the ctDNA shows the poor prognosis compared to the negative the MLD at the baseline. And there was a patient who had a positive MLD, but with the adjuvant chemotherapy, some patients went to the negative on the ctDNA, which means that was clear with the adjuvant chemotherapy. Those patients shows better efficacy outcomes, better recurrence or the overall survival outcomes compared to those who remained positive. So this study shows that it demonstrates that the ctDNA is very useful to be informed about the prognosis and the treatment course with the adjuvant chemotherapy for this the BTC patients, because BTC is very rare disease and the standard there's no established standard of surgical resection of the BTC, so many patients are undertreated in terms of the surgical resection. So this MRD analysis using the ctDNA may be very useful to be informed, to give any information to the patients about their prognosis and the outcomes.